So it's lovely to be able to join you all today in your conference. Jim and I are delighted to be invited by the Chinese chapter to present a little bit about the seed model of supervision. Like many of you, I guess, attending the conference, I've been on some great training. And sometimes I find a little bit like a cookbook that when I go home, I maybe start to kind of go back to the same old recipes that I've perhaps cooked before. And I lose confidence in terms of implementing the training that I've been on. So it's one of the reasons why we developed the seed model of supervision. We wanted to embolden supervisors to encourage more people to be at consistent supervisors because it's not grown at the same rate as clinical training has. We hope by putting this model together that it might encourage more of you to be supervisors that have a consistent practice and supervision to the model. Put a link here where you can download a free ebook that we've created that we hope that will support you in your practice.
Thanks, Sally. And I'd just like to say that if you're a supervisor, then this is going to be useful for you. But also if you're a supervisee, which I guess we probably all are if we're doing some client work. And so our hope is that this model, but also this short 20-minute video will help you in both of those roles that you have in your life. And so my name's Jim Lucas, and I work as an ACT therapist and trainer and supervisor in the UK. And I've worked in private practice since 2011. And I supervise many ACT therapists online, individually and in group settings. And I run something called the ACT Practitioners Community, which is an online community. And Sally and I have co-authored the SEED ACT supervision model, which we're going to talk to you in more detail about today. But aside from my work and what we're doing here, just to tell you a little bit about me, outside of that, I like to be outside as much as possible. I like to run and I like to go on adventures. In terms of my values, I really strive to be patient, kind, brave, and creative. And I often struggle to live consistently with those values, probably just like a lot of other people here today.
I love that kind of human introduction there that kind of Jim gave. I guess we're kind of sharing our credentials, but I guess also trying to connect with you all as kind of colleagues and clinicians and human beings too. So my name's Sally Bradley. I work as a clinical psychologist based in the UK and have the privilege of supervising people all over the world, including I have some at Ningbo in China. And I'm also the co-author of SEED and ACT supervision model. And as I kind of say on this slide, like my mind tells me that I'm an imposter. Like there's nothing particularly extraordinary about me. And I hope that that's how I can kind of connect with you, that I try to see people as my clients or my supervisees and do the best that I can. And we're trying to share our experiences with you. I also love being outdoors, much like Jim. And I'm at a stage in my life where I'm noticing kind of hormonal changes. I've recently been bereaved, and I think it's important to kind of share those life events to enable us to think about our supervisees as human beings too, and how best to kind of recognise where they're at and the support that they need. But also, I guess it's an opportunity for us to practice our own ACT skills there and to learn from that experience and share that too. I wanted to share a little bit about me too, in terms of I guess I have a relatively privileged kind of life, and it's important to acknowledge, I think, that that will be different for some of the people that we work with as supervisees and their clients. And I share this, I suppose, to inspire you to reflect on your own kind of privilege and your own context and how that may shape and sometimes cause unconscious kind of biases in our work and how we can be kind of more attuned to that a little bit, but also help our supervisees to think about that and how that might be relevant in the clinical room too. And as ever with the ACBS, such a kind of giving community, think in terms of us producing the ebook, we want to just acknowledge the literature that we've kind of reviewed, and we're not always able to kind of particularly kind of credit that. So please do download the ebook. There is a big reference section within that. We want to share, I guess, our appreciation of the community, and also, I guess, acknowledge the learning that we've done from our own supervisees and our own supervisors, um, and the giving nature that we have.
Indeed, yes. Thank you, everyone. And so this is what we want to talk to you about today. We're going to talk about something called the SEED model of ACT supervision. And SEED stands for these four subsequent things. How to create a safe place to be curious and learn. Exploring functional analyses in supervision. Experimenting with experiential methods. And then building deliberate practice routines. And so we'll talk about that in more detail. But we're giving you a bit of context for the development of SEED, is that it has come after several other things written about supervision in contextual behavioral science. And so if we go back to 1995, we can see one of the first things written about supervision through the behavioral analytic approach written by Follett and Callahan. And over the course of these next 30 years, you can start to see several other important pieces of literature on the supervision in this area, with Robin Walls and Dara Westrup's Supervising Trainees in ACT for PTSD. There's Sonia Batten and Andy Santinello's 4 Phases of Emotional Awareness training model. And then in 2015, there was the Portland model of peer consultation. And then in 2017, the SHAPE framework that supports experiential learning and psychological flexibility. And then just in 2024, Sally and I put together the SEED model of ACT supervision that builds on many of those things that we've read and understood and that have come to be part of what we know and what we do. And quite a strong relationship between the SEED model and the SHAPE framework as well. But if the SHAPE framework gives us a broad recipe of the different things that are important to include in supervision, the SEED model is more about how do you structure a session? What do you do in a supervision session?
Can I jump in there, Jim? Because it's almost like shape might be almost like, I don't know, the ingredients list, and seed is maybe a little bit of like the recipe, like the method kind of stuff. Does that fit?
Yeah. Well, you get both those things, don't you, when you're trying to cook? And you need both, don't you? One doesn't work without the other. So yeah, thanks, Sally. That's a lot, probably that helps to describe what the relationship that we see between seed and shape. We'll briefly give you an overview of the model in this illustration here. And the word seed means to cause something to grow or develop, which closely represents the spirit of supervision. And so we start off by creating that safe place, creating an environment, a context where people can come together and feel that they can learn in a way that works. And so we're trying to build trust and establish a collaborative working relationship so that we can do things together. Historically, supervision was much more a sort of expert and passive recipient type of relationship where somebody just received knowledge. But now supervision has become much more a teamwork type relationship. So once we've began to establish and continue to invest in that kind of environment, it makes sense from an ACT perspective to focus on context and focus on function. And so our second piece of the SEED model is about exploring those things. And we can explore individual and interpersonal behavioral functions in therapy and supervision. Thirdly, we then move on to experimenting with experiential methods. This is where we try to shape skills, get people to do new things in contexts that they weren't able to do them so easily before. It's about experimentation and trying out something different. And then to complete the cycle, we want to bring in this deliberate practice component, very similar to committed action within the ACT model, where therapists would identify tasks that they want to focus on to improve their skills. And we'll talk about these components in a bit more detail as we go through the rest of today.
Thanks, Jim. So the first part that Jim spoke about there in the model is about kind of creating that safe place to be curious and learn. So we see that there are different elements that could be kind of central to this. And for the purposes of time today, I'm going to give you like a little taster of maybe one or two of them. We don't have time to go through them all. This is about us being able to kind of create that kind of context, if you like, that I'm kind of doing this with my hand, that place, I guess, where people can feel kind of safe to kind of bring the difficulties that they're kind of experiencing. Not sure about you personally or about the supervisors you might work with, but often I think our supervisors can kind of feel kind of shame or kind of a sense of not knowing something and maybe that they should. So we kind of need to create this place where they are able to kind of to bring that, and so that we can support them with that so that they can grow in their knowledge and their skills. There are different ways that we think that can be helpful to do that. And that might be thinking about developing agreements, thinking about their values and barriers to supervision. And that's something I wanted to highlight here, maybe, is thinking about what's important to them in the supervision relationship. And in terms of perhaps barriers, it can be useful to perhaps draw on their past learning experiences, things that have been helpful in the past or unhelpful perhaps in terms of supervisory relationships. Perhaps noticing the rules that they may have about who they think that they should be in supervision and how we can perhaps get hooked by that. It might kind of limit our ability to be a bit more vulnerable and open to maybe say, I'm not sure about doing something or how to do something. To invite maybe more willingness to be kind of more kind of playful and experiment in supervision. As Jim mentioned before, it's not so much about doing what we're told to do, and often we have that sense we must always do what we're told to do, but be able to kind of play with things more in supervision to see what might kind of work in the safe area. Other aspects here around us, kind of being kind of clear about the experiential nature, which we'll talk a little bit more about later, and the menu of different things that we can do. And we already kind of started talking around today about acknowledging our different unique kind of contexts we come from, our kind of culture, our histories, our gender and sexuality, and how it's important to draw attention to those. And also thinking about linking to values around seeking feedback in terms of whether we're being effective in what we're doing, whether we're meeting the supervisees' needs. Sticking with that idea and the metaphor of food, we would like to offer you a menu of things that you can offer in supervision. Sometimes we have a rule or an expectation based on past experience that we might bring someone that we're kind of struggling with, and then we might be told what to do. But there are many different ways that we can offer at consistent supervision through more experiential kind of methods. And one of the things I wanted to highlight on this list, and it's quite low down because most people don't like doing it, is thinking about recordings. And when I say that, I just want you to notice what you might feel about the thought of actually recording a session with somebody and then being that kind of sense of being kind of exposed and somebody perhaps rating what you might be like in terms of as a therapist. And I have this feeling now myself, because I'm no different to you, and I imagine Jim's the same too, that it can be quite an exposing kind of thing to do those recordings, the fear of kind of looking silly. I know that I feel like that now, just recording this for you. And recordings can be so powerful. I think about a recent time with a supervisee when they brought a recording, and what I noticed in the recording was a missed opportunity. And that's, I think, something that recordings can give us. Because if the supervisor had described the client, I don't think they'd have used the precise words the client used, which were about a tug of war. And most of you may be familiar with that as a metaphor that we use often in ACT. But because I heard that on the recording, we were then able to bring that into the supervision session and really flesh out the metaphor and the functions of that metaphor, and then help that supervisor use the words that the client had given them in their next session. So I invite you, when you go away from this, to think a little bit more. No, not to think, to have a go at recording a session and taking that to supervision. With the fear that maybe you've not done something right. That's what supervision's for, is about looking at different ways we can do things. And it may not be the right way to do something, but more flexibility in our practice.
Thanks for the invitation. It's really helpful to see a menu of different things that I can use supervision for. So I really appreciate that. I'm going to talk next about exploring functional analyses in supervision. So this is our second part of the seed model. Once we know how we might begin to get into the work, like whether that's through a recording or through something else, it then makes sense, of course, from an ACT perspective to focus on context and focus on function. And an effective functional analysis, I believe, does a number of things, including identifying and exploring those contextual relating patterns. So, do we know what view of the self the client is dominated by? Do we know what rules they rigidly follow, or what experiences they try to avoid? Our functional analysis, it's useful when we can see that information there. It's also helpful to know what overt behaviors are done in a way that work against them. So when people run, fight, or hide from painful experiences, in what ways do they do that? What overt behaviors can they see? Can you see? And that might be things that they're reporting doing out there in the world in their life, and things that you see them doing in the therapy session, or things that you see your supervisee doing in the supervision session. And then also is useful to capture those reinforcing consequences. What are those unintentional complaints or problems that people get stuck with, such as anxiety or frustration, for example? You can then start to see how these things piece together. But a contextual perspective also asks us to look at learning history. It wants us to see what's the thread between the past and what's happening now. And so I think a decent functional analysis also includes that. And then it can help to have some environmental context, some things or that influence how things are felt and done when they're happening here and now, what's taking place in the setting, when certain people are present or not present, how does that influence what happens for somebody? So my view is that an effective functional analysis includes those things. How can we do it in supervision? How can we use it? I think we've got choices. While supervision primarily focuses on the welfare and of the client and the client's recovery, it can also be useful to focus on other aspects of what's going on. Yes, it makes sense to focus on the client's context, but it might also make sense to focus on what's going on between the therapist and the client in order to help the client. So you'd look at that interpersonal context between the client and therapist as well. What I experience now is influencing how I'm talking, how I'm presenting now. So what's going on in my context, if I'm in either a therapist role or a supervisor's role, as well as what's going on between the supervisor and supervisee. So different ways that you can zoom in on a functional analysis. And then to keep it simple, I like to follow these 5 steps when completing a functional analysis for a client to help you be efficient with what you're talking about so that you're not getting lost in detail about a client's difficulties. Would it be possible to start at the first one here and look at what's the client doing when you as a therapist feel stuck? And then what do you notice in your experience when that happens? And after that experience, what do you do? And then what happens after that? How did the client respond? And then what information does that give you that you can add in a useful way to the functional analysis? So, of course, we're just giving you a taste, an introduction here to using functional analysis in supervision and a way that you might do that.
Thanks, Jim. I think it's so common, I think, when I start to supervise somebody and they've perhaps been on some introductory kind of training and then they kind of come with wanting to kind of know what to do in the next session with the client. And I guess it's an apt kind of answer, but like, well, it depends. And I guess it has to come back always to that functional analysis. It's not we do this and then that, and it's a natural kind of sequence. It's actually we need to understand the function of the client's behaviors, which would then shape, I guess, the next kind of intervention, the next kind of movement that we might then make. And I guess the way that we can do that is kind of being more experiential. In terms of thinking about experiential methods, I guess there's three different kind of processes, if you like, as overarching that we can think about here. So the first is kind of modeling. Can we kind of show what we'd like to see from our supervisees? Can we kind of demonstrate that in some way? Can we then evoke that in them too? Invite them to kind of practice that behavior. And that's something I suppose I wanted to focus on with you now, is I guess inviting someone to do something. And, you know, we can sometimes kind of feel, I guess, kind of anxious, like we're kind of on a stage. But if ever you've been seen any kind of, I don't know, dress rehearsals, have been in any productions, and people often might stand there with a script in front of them. They don't know all of their lines off by heart at the start. And so it's not cheating to have a go in supervision. It may be inviting someone to kind of read from a script, have a little play with something from a book, but then to try it on. This is kind of exposure, if you like, within supervision, to see how it kind of sounds when they say something, to get that feedback from you, and then to find their own words and their own voice, perhaps, when they're trying to say something. And then the last part of this here is about reinforcing. They're giving feedback, encouragement. But I think the best kind of reinforcement sometimes can invite the supervisee to kind of reflect on their own experience. How did they feel that went? How did they feel inside themselves? So they're kind of tuning in and able to kind of track that for themselves. Or if they're in a kind of clinical session, well, what did the client do next? A bit like Jim was just talking about in functional analysis. How did they respond when you did that? And what reinforcement does that maybe give you about what you just did? There are different kind of procedures that we might invite you to do in terms of kind of being experiential. We have real play and role play, and I'm sure many of you have had experiences of that on training. You may even have been doing some of that on the conference that you're here. Demonstrations, practicing techniques, metaphors, and video and audio feedback, but I've already invited you to have a go. What I wanted to focus on now, I guess, was that sense of kind of role play. And again, that's something else that sometimes can feel a little bit uncomfortable. We might come to supervision with the expectation that we're going to be kind of told what to do. And this is like kind of a playground, if you like. We're not kind of trying to win an Oscar here. This is where we can have a sense of trying out some ideas. If I think about a recent example with a supervisee, and she kind of acknowledged afterwards that if I'd have made a suggestion, she'd have like, yeah, okay, write it down. Sally said that, I'll have a go. But we played with it in supervision, and we kind of role played it. So I was trying to demonstrate what I thought might be kind of helpful, and she played the role of the client. And it was so insightful because she realized that actually the client's kind of responses, it wouldn't have kind of worked. And we only got that through actually kind of trying it on and playing it out. And then with that feedback, we then refined it and came back with something else that through doing that, she felt like would be more helpful and effective for that client. This is my other invitation to you. Remember, there's that deliberate practice section coming up soon, is have a go at some role play in your next supervision.
Okay, so then this brings us to the last piece of the SEED model, which is about deliberate practice. And so got some evolutionary and process-based ideas running through this as well. Well, deliberate practice starts to become then about retention. How do you retain new things that you're doing? Like maybe that experiential way of working is about variability. Functional analysis is about sensitivity to what's happening here and now. And here we are then, deliberate practice, seeing how can we get better at something? How can we improve skills in a certain area? So rather than ending supervision with a vague or a unspecific sense of what you're going to try and get better at, deliberate practice invites us to be quite focused. And some literature that suggests that that can be a helpful thing to do indicates that when you compare deliberate practice with routine practice, deliberate practice predicts skill development much more strongly. And so routine practice is really just doing your day-to-day work, turning up, seeing your clients. It's not being unreflective. It's not trying to do anything that's not different. But routine practice doesn't have that very explicit, emphasized approach of what it is that you're going to do. And so it is about trying to target something that you're going to do differently rather than something that you're just going to try and understand. And it be guided by personal learning objectives that you and your supervisor or supervisee can identify together. And you can use supervision to practice and rehearse some specific skills. Getting better at stuff is really difficult on your own. We need that feedback. We need people to be able to say, from over here, when I see you do that, there's something that I see that I would like to show you. There's some other way that we might be able to work at this, come up what's going on here. And so that feedback and that coaching element of deliberate practice is really, really useful. And then it also gives us some way of then improving and refining what we've targeted. So that's what deliberate practice is. How then might we use it in a practical way in a supervision session? Well, it makes sense that you can start first of all with what it is that you want to get better at. It might be, I want to get better at creative hopelessness. It might be that I want to get better at values construction or selfless context interventions. And then you begin to practice assessing how well you think you're doing at that at the moment with the help of a supervisor, then tracking what happens when you do that intervention, and then modifying the way that you do it based on what happens. And we can practice this in different contexts. We can practice it with a client. We can practice it in our own lives. And I practice it in my relationships, in my home, when I'm investing in my self-care and my well-being. And can I use supervision as a space to improve things? And then having a worksheet in which people can record their practice gives you a very clear way of naming what you're doing and following what you're doing and then reflecting back on what you're doing as well. And there are some worksheets within our ebook that we'd be happy to share with you about that.
I think that's it then. We have given you an absolute whistle-stop tour of the seed model, and we would thoroughly encourage you to download the ebook. The ebook itself is kind of free to download, although if you feel able to, then we would invite people to make a donation to the ACBS Foundation. Very much part of our kind of values too is to try and get kind of ACT out there to as many people as possible. It enables people to attend training, further research, and to reduce suffering and promote well-being in the world. If you would like to contact either of us, then please do. And yeah, we wish you well for the rest of your conference. Thank you for inviting us to join you.
Thank you very much.